everyone. Hi, Dr. Jeff, and happy
Hey,
birthday.
Oh, thanks so much. I appreciate it. Another birthday.
Another year. How
Another
do you
year's
feel?
I feel like you're younger.
Yeah, you look younger. Than
Thanks.
I don't know what you're doing, but... Doc, okay, so this is... You were going to say sorry?
No, I'm just happy to be here for another year.
Okay, great.
All right. Absolutely. In fact, I've been with Smart for 3 years. In a couple of days, it'll be 3-year anniversary.
Yes.
On June 6th.
And stay
So it's been a great 3
tuned
years.
because we're gonna post today later a biography that you can see and sneak in and see all the details about his life. And okay, hi everyone, thank you for joining. And this is another live session with Dr. Jeff, and we're gonna take some of the questions. So if you want to ask Dr. Jeff a question, today is his birthday, so you can put anything here on this box, and we're gonna he's gonna answer that.
Right.
Also, we have some previous questions that you guys did, and want to start with Helen Inc. How soon after a tummy tuck can you start a GLP-1?
Right. So typically, we hold off on those for really a month. It depends on whom you ask. It could be 2 to 4 weeks before and 2 to 4 weeks after. All right, because they affect gastric motility. So we just, I think 2 weeks is fine. Some people will hold off even for 1 month before surgery, right? Because we don't want anything slowing you down before the surgical process, before the anesthesia. So let's just say probably 4 weeks before and 2 weeks after.
Oh, 2 weeks after. Okay, that's great.
And that's for residual anesthesia effects.
Yeah, and for the people that, if you don't know what is a GLP-1, and these apply for all those shots.
Right, they're all the same. Right, exactly.
Oh, okay. Can you just
like
explain?
Ozempic, these are a group of drugs that actually slow down the motility. So they slow down gastric emptying. That's what makes you feel full. All right, so it's a very simple mechanical method, and it's very effective. You know, so now they're doing these orally as well. So this is this is like a revolutionary means of weight loss. So it's been fantastic.
Wow, awesome.
It's really pretty effective.
Doctor, we have some people saying here, happy birthday,
Oh,
Doctor
thank you.
Jeff. Queen Wild, oh, okay. Well, I don't know. Well, turn Kia. She says happy birthday. I'll take that
Thank
after
you.
the live for sure. I'll do. Does the center do Vaser Lipo 360, or should I add it in addition to J plasma?
Oh no, we do Vaser. Which is vibrational. So we have Vaser. We have a number of different technologies here. We have Vaser. We have J plasma. So depending on what your needs are, depending on what you come for, we can address that and offer these if you qualify for those and if you need them and would benefit from them. So that's a good question. Come in, send a photo, or come take a look. We'll take a look in person, and we'll have a conversation about that.
Absolutely.
Sure.
I have Jada Martinique. Can we do a tummy tuck without tightening the abs? I heard
Sure we can.
that's the worst part of healing.
The worst part of healing, right? But it's also probably the most important part of the procedure, right? So you repair the muscle from this point here, in the sternum, the xiphoid, all the way down to the pubic region, making the belly flat as a board, right? So that's a really important part of the procedure. It's a little bit tender, but I wouldn't shy away from that because of the tenderness, because in the first few days, that's going to resolve, and you'll have this muscle repair for the rest of your life, right? There may be one reason that she's not stating why she's concerned. That might be because she wants to get pregnant, all right? So that might be the reason why she's asking. And my answer to that would be, that's not a huge issue, all right? I've had many patients over the years, mostly female, who get pregnant afterwards, right? The men don't. All right, so they get pregnant afterwards, and it doesn't destroy the repair. All right, so it really doesn't. The repair is solid. It's now your new muscular, erectus muscle, and basically they expand with pregnancy. And then, worst case scenario is down the road there may be a little bit of laxity, which we can correct, but the muscle itself is not going to have any adverse effect on the uterus or the pregnancy, and the skin itself though will still stretch. So if she's not concerned about the skin, she shouldn't be concerned about the muscle. If she's concerned about the recovery after the repair, she shouldn't be, because it's such a valuable part of the procedure. So I typically tend to do it every single time. But we don't have to if you don't want me to.
Doctor, this is our friend. Remember the nurse Jaja with attitude from, I think, Philadelphia?
I do.
Hola, okay, I'm feeling amazing. I'm 8 weeks post-op, tummy tuck and breast lift with implants with Dr. Jeff. Love my results. God bless them hands.
Right. Thanks so much. I appreciate that. I appreciate that.
Doctor, can you do a tummy tuck and BBL?
And arm lift.
Oh, and arm lift.
At once. So a triple combination. So yes, we can do it and we do it, but first we need medical clearance, need to make sure there are no other medical issues, pulmonary issues, things that would cause us to have any kind of anesthesia issue with a little bit of a longer case. Not a terribly long case, but a little bit of a longer case. So that's always the concern. If it's safe, we can definitely do it. I won't get tired. All right, so we can definitely do the procedure. And if we feel that there's some medical reason why we don't want to do all of that together, then we just stage it and we come back and do the rest of the procedure another day.
So Normita Collins, I'm gonna take that after the live for sure. So wait for my message. And the Lingling, I want to change with Dr. Jeff. How much is it for Lipo 360 at BBL? Send me your name, your phone number. I'll take it. If you do a tummy tuck while 15 pounds over your goal weight, would weight loss after the tummy tuck be okay?
That's a great question. Okay, so 15 pounds, not a huge amount. Right?
Oh,
so that would not be a reason to be concerned about doing the procedure. So we see people who are 30 and 40 and 50 pounds over. Okay, so not a problem doing the procedure, number one. Number two, my recommendation for everyone having this procedure is to lose 10% of body weight over the next 6 months following the surgery.
Wow.
So your question is just right
That's
on target.
That's something that you require to your patients.
Yes,
Oh,
so
nice.
that's really what we want, so we have the best result down the road. So I do everything I can. I do 1 million sit-ups for you basically while you're sleeping, right, for the abs. Like for the other patient, she's going to miss out on 1 million sit-ups that I'm doing for her. Don't do that, all right? But as far as this is concerned, that's not a problem at all.
Okay. So, doctor, and when you said that, talking about back to the procedure that is a triple combo procedure,
right?
So when you said safe, what do you mean?
What do I mean by safe?
Yeah, when you said like if she's
that we're not anticipating. All right, so safe. So the hemoglobin is not too low.
Oh, okay.
Okay, that there aren't any respiratory lung issues that would affect the anesthesia. Things like that.
Oh, okay.
All right.
Okay.
So if there are, then we optimize things. We get your hemoglobin up. We don't do the 3 procedures. We do the 2 procedures. And sometimes we've had people come in for 3 procedures, and we do 1 procedure.
Yeah.
It just depends. We do what we're going to do. It's safe. If you were my relative, I tell them this is what I would do.
Yeah.
And I mean, it's the same thing I would do if you were my relative.
Yeah, and
assuming
here.
it's a relative I like. You know what I'm saying? But that's the bottom line. That this is how we would treat our family, and this is how we would treat you also. So it's got to be safe.
Yeah. Daniel, I'm trying to schedule for July. So excited. Okay. Well, Dr. Jeff, let's take just a minute to talk about traveling to Miami. This is a question that we always get. Like how long people should stay
that's a great question.
in Miami.
So it depends.
Yes.
All right. So if you're just coming to see me for the consultation, you go home the same day. All right. If we're doing shorter procedures, which might be say straight liposuction or breast augmentation, things like that, you can actually go home the same day or the next day. If you want to recover a little bit, go home the next day. But if we're doing things like a tummy tuck, we definitely want to keep you here for really 7 to 10 days would be ideal.
Yeah.
Right? Because we see you, several times during that period. We make sure you're healing well and make sure there are no issues. With going back to the liposuction, you could leave, but with the liposuction BBL procedure, you can also stay for a number of days and let us start the lymphatic massages. So we get those started, make sure that you're healing nicely, that you're draining nicely, appropriately, and so it varies based on the procedure.
What are you doing today for your birthday, doctor?
What am I doing today for my birthday? Oh, just like some family stuff later on.
Nice.
Not going anywhere major, but.
Well, thank you for being here. One day working for your patients and your birthday. Thank you everyone for joining.
Good seeing all of you, and we'll be back next time.
How long until? Oh my God! Everybody started asking questions right now.
Do it.
How long until can start wearing the faja for only 12 hours?
How long can you? I think like 2 years from now you can narrow it down to like 12 hours.
Yeah.
Typically we wear it for like most of the day, and ideally if you have the procedure today, we want to wear it for 6 to 8 weeks for sure. Okay, and then I think at that time frame you can kind of like dial it back a little bit. All right, but the more you wear it, the better it's going to do. Is it critical? It's not critical, but you'll have swelling for a longer period of time. So it really expedites the recovery process and getting to that final result.
Can I come to meet Dr. Jeff before my surgery just to confirm the procedure? I'm interested.
Of course.
Yes.
Come on down. Of course, we do that all the time.
Jaja
course.
with attitude, happy birthday.
Oh, thanks so much.
Dania, happy birthday.
Thank you, guys.
Well, thank you so much. Thank you, doctor, and happy birthday again.
Thank you. We'll see you guys next week.